Every week, someone sits down in my exam room and asks me about Ozempic. And I mean every week, sometimes multiple times a week. They've seen the before and after photos. They've heard the celebrities talk about it. They've seen their friends lose weight on it, and they want to know, should I be on this? I'm going to give you the honest answer, not the pharmaceutical company answer, not the internet hype answer. The answer I give my patients when we have enough time in the room to actually talk through it. Hi, I'm Dr. James Miller, family physician, and today we are having the Ozempic conversation your doctor probably doesn't have time for during a 15-minute appointment. Let me start with what Ozempic actually is, because a lot of people don't fully understand what they're asking to take. Ozempic, the brand name for semaglutide, was originally developed as a treatment for type 2 diabetes. It works by mimicking a hormone your gut naturally releases after you eat. A hormone that tells your brain you're full, slows down how quickly your stomach empties, and helps regulate blood sugar. The weight loss effect was noticed in diabetic patients, and the manufacturer eventually got a higher dose version approved specifically for obesity, which they sell under the name Wegovy. Clinical trials showed that people lost on average around 15% of their body weight. For someone weighing 220 pounds, that's about 33 pounds. Those are real, significant results. I'm not going to pretend otherwise. So why am I not writing prescriptions for everyone who asks? Let's talk about money first, because in America, this conversation always has to include money. Without insurance, Ozempic costs around $900 to $1,000 a month. Wegovy, the obesity-approved version, can run even higher, over $1,300 a month in some pharmacies. Medicare Part D currently has limitations on coverage for weight loss drugs. Many private insurance plans don't cover it either or have strict prior authorization requirements. I have had patients who got approved, started losing weight, and then lost coverage when their employer switched insurance plans. They stopped the medication, and I'll tell you what happened in a moment. Even for patients who can afford it or get coverage, this is a long-term commitment. This is not a 12-week course of medication. The data shows that when people stop taking it, most of the weight comes back. One major study found that a year after stopping semaglutide, participants had regained about 2/3 of the weight they lost. The drug doesn't fix the underlying metabolic issue, it manages it the way blood pressure medication manages high blood pressure. Stop taking it, the problem comes back. That's not a reason not to take it for the right person, but it needs to be understood upfront. Now let me tell you the thing that concerns me most as a physician, and this is what I think gets lost in all the before and after photos online. When you lose weight on Ozempic, you don't just lose fat, you also lose muscle. In clinical studies, somewhere between 25 and 40% of the weight lost on semaglutide was lean muscle mass, not fat. That might not sound alarming until you understand what it means for someone over 50. After 50, you're already losing muscle naturally, about 0.5% to 1% per year just from aging alone. Muscle is metabolically active. It burns calories even when you're sitting still. It protects your joints. It keeps you functional as you get older. It's the tissue that lets you carry groceries, climb stairs, get up off the floor, maintain your balance. Losing significant amounts of muscle mass has real consequences for long-term health and independence. The people losing weight in those before and after photos look thinner. What you can't see is what their body composition looks like. Some of them are lighter, but actually in a worse metabolic position than before. Less muscle, same underlying fat percentage, slower metabolism. This is why, when I do have patients for whom I think semaglutide makes medical sense, I insist that they do resistance training throughout the entire time they are on the medication. Not just walking, actual strength work. And I make sure they are eating enough protein to try to preserve as much muscle as possible. Most patients who get these prescriptions do not get this guidance. They get the shot and a generic handout about eating less. Let me also be direct about the side effects. The most common ones, nausea, vomiting, diarrhea, constipation, are real and they affect a lot of people, especially in the first few weeks. Most people get through them, but for some people, they are significant enough to stop. There are also more serious potential risks. In animal studies, semaglutide was associated with thyroid tumors. That has not been confirmed in human studies, but the drug carries a black box warning and is contraindicated for people with a personal or family history of certain thyroid cancers. There's also a risk of pancreatitis, inflammation of the pancreas, which is serious. And some studies have suggested it may worsen a specific type of eye disease in diabetic patients. I'm not telling you this to scare you. I'm telling you because informed consent matters. And I think the way this drug has been marketed and discussed publicly has not served patients well on the risk side of the equation. So, who does it make sense for? In my clinical judgment, semaglutide has a real role for patients with a BMI over 30 or over 27 with serious weight-related health conditions like type 2 diabetes, high blood pressure, or sleep apnea. Patients where the cardiovascular risk of their current weight is greater than the risks of the medication. Patients who have genuinely tried sustained lifestyle changes and have not been able to make progress. And patients who understand it's likely a lifelong commitment, not a temporary fix. It does not make sense, in my opinion, as a first-line treatment for someone who is 20 or 30 pounds overweight and hasn't yet made a serious, sustained effort to change their eating and exercise habits. Not because I am judging anyone's effort, but because the medication comes with real costs and real risks that aren't justified when less invasive approaches haven't been tried. I also want to address something I see happening in my practice that genuinely worries me. People are getting these prescriptions from online telehealth platforms, sometimes after a 5-minute video call, without any real evaluation of whether they are appropriate candidates, without discussion of risks, without monitoring for side effects, without guidance on how to protect muscle mass during weight loss. The convenience is real. The lack of oversight is also real. If you are considering semaglutide, I'd encourage you to have this conversation with a physician who knows your full medical history. Not just your weight, your cardiovascular risk profile, your thyroid history, your family history, your current medications, your kidney and liver function. This is not a casual decision. Now let me tell you something that might be the most useful thing in this video. Whether you're on Ozempic or not, whether you ever take any medication for weight loss or not, there are 3 things that determine long-term success with weight and metabolic health after 50 that no drug can replace. Muscle mass. The more muscle you have, the higher your resting metabolism and the better your insulin sensitivity. This comes from resistance training, period. Sleep. 7 to 8 hours of quality sleep regulates every hormone involved in hunger, fat storage, and metabolism. Chronic sleep deprivation undermines everything else you do. Protein. Enough protein, and most Americans over 50 are not getting enough to support muscle maintenance and satiety. If you do those 3 things consistently, you will change your metabolic health. It's slower than a weekly injection. It requires more sustained effort, but it doesn't cost $900 a month. It doesn't cause muscle loss, and you don't regain the weight when you stop. I'll have a video on each of these coming up. If you want to understand what I actually recommend for patients over 50 who want to lose weight and keep it off, stick around. Next video, I'm going to talk about why everything you learned about dieting in the 80s is actively working against you now. See you then.